Moses Sinclair is a 68 years old male with a complaint of pain and weakness on the right wrist. He started having pain and weakness on the right hand and wrist 3 months ago. It lasts 30 to 60 seconds and starts gradually. It comes and goes and is getting progressively worse with repetitive use. Rubbing the hands at night and taking Tylenol extra strength relieves the pain, and he rates the pain 2 to 6 out of 10. He takes 2 pills of Tylenol 500 milligrams every 4 to 6 hours for pain. He doesn't have any known allergies, and he denies having any major illness, hospitalization, or surgery. Family history: the father is 91 years old and has type 2 diabetes. The mother is 90 and had a stroke 10 years ago. Brothers and sisters are well and alive. He is married and lives with his wife, and he doesn't have any children. Works as a carpenter 50 to 60 hours per week and has a high school diploma. He feels safe at home. On the physical exam, he appears healthy. He's an adult male with no acute distress, alert and oriented, answers questions appropriately. He is 5 feet 10 inches tall, and he has 195 pounds, reporting gaining 5 pounds over the last year. All the symptoms were reviewed with no deficit, except the musculoskeletal, in which the patient has weakness and a decreased grip on the right hand and wrist, and also pain. He also appears to be a little bit anxious about the current symptoms. Vital signs are as follows: temp 37.6 Celsius, blood pressure 134/64, heart rate 75, and respiration of 20. I have 3 differential diagnoses. Cervical radiculopathy, as it presents with unilateral sensory loss, pain, and motor dysfunction. Considering that the patient's weakness and pain is on the lower hand and it doesn't affect the entire arm nor the neck, makes me possible to rule out that differential. Another differential, diabetic peripheral neuropathy, which presents with progressive sensory loss, pain, and numbness in the extremities gradually over the time, like in the case of the patient. The fact that the patient is not diabetic makes me possible to rule out that. The third diagnosis, differential, it will be carpal tunnel syndrome, caused by compression of the medial nerve at the carpal tunnel level, leading to numbness, weakness, and pain on that area. Some of the tests I performed in the office were a Tinel test, which led to a positive result when I tapped over the carpal tunnel, producing symptoms on the medial nerve. I also performed the Fallen test, in which I flex the hands at 90 degrees, and the patient flexing caused symptoms on the medial nerve. And I also did the pinch test, which was performed, resulting in a decreased right hand strength. Therefore, the most likely diagnosis is carpal tunnel syndrome, because the patient has a positive Fallen test, a positive oral normal Tinel test, and a positive oral normal pinch test. Also, the patient is experiencing that shooting electrical pain, and that weakness on the right wrist is consistent with carpal tunnel syndrome. Therefore, patient will benefit from NSAID medication. If it doesn't work, he will benefit from a steroid or corticosteroid injection. If it doesn't work, he will also benefit from ultrasound guided therapy, which is reported to be beneficial. And more than anything, he needs a brace on the wrist to immobilize and give relief to the symptoms. Lastly, if with all this intervention doesn't resolve, the patient will need surgery. As far as education, I taught the patient to take the brace twice a day to assess the skin for integrity, circulation, and sensation. I also taught the patient to report any GI discomfort, any tarry or black stool that could be a side effect of the NSAID, such as GI bleeding. As far as cultural, I asked the patient if he has any cultural consideration or any cultural practice to manage the pain. He denied. I also assessed his level of literacy to tailor my teaching to him. Health promotion, I encourage the patient to get the vaccination, such as herpes zoster, flu vaccine, COVID vaccine, because he's not up to date with vaccines. I also encourage the patient to have the colonoscopy and do the testicular examination. And as a follow-up, I told the patient to come back as needed.